Je me présente, je suis Dr Hossein Feb, je suis cardiologue interventionnel, je suis le référent dans le centre de l'insuffisance cardiaque avancée et je vais présenter en anglais. So, the title of, so I'm honored to be present here with you. So the title of my presentation is short and medium-term results of percutaneous closure of atrial septal defect in adults aged 40 years and over. So I don't have any conflicts of interest. So to introduce the thematic, atrial septal defect is the first congenital heart disease in adulthood. Among the different types of atrial septal defect, only the ostium secundum atrial septal defects are clearly have their indication. Although the benefits of percutaneous closure have been well demonstrated in children, the benefits in adults 40 years and over all remain questionable. So, during the last 2 decades, a few studies have been conducted on patients aged 40 years and older, in whom percutaneous closure of the ostium secundum atrial septal defect was performed with a satisfactory success rate and a low rate of complications, thus demonstrating an improvement in functional status and echocardiographic parameters. So the aim of our study was to describe short and medium-term evolution of patients aged 40 years and over and who benefit of percutaneous closure of their atrial septal defect. So methods, this was retrospective, descriptive in single-center study, carried out in our cardiology department, Sahlul Sus, including patients aged 40 years and over with ostium secundum atrial septal defect, and they was eligible for percutaneous closure between April 2001 and December 2019. Atrial septal defect, ostium secundum, and patients with ostium secundum atrial septal defect but with unfavorable anatomical criteria and those who had fixed pulmonary arterial hypertension were not included. So only 27 patients were included and were studied clinical data, ECG, transthoracic echocardiography, as well as cardiac catheterization. A transthoracic echocardiography was performed in all patients before closure, and all procedures were performed under transesophageal echocardiography. The criteria for successful percutaneous closure were the absence of residual shunt of the presence of a minimal residual shunt, the absence of major complication, and the absence of embolization of the protesis. An evaluation was done within 3 months, followed by another evaluation at 6 and 12 months. So let's see the results. 27 patients were aged 40 years and over, which were included with a female predominance. The mean age at the time of percutaneous closure was 50.85 years. Exertional dyspnea represented the most frequent circumstance of discovery. For example, we see also palpitation, precordialgia, heart murmur on the auscultation. An incomplete right bundle branch block was found in 85.2% of cases, and on transthoracic echocardiography, the mean diameter of the atrial septal defect was 24 millimeter. All our patients had a dilatation of their right cardiac chambers with preserved right ventricular function. Pulmonary arterial hypertension was found in 55.5% of cases. On transthoracic echocardiography, transesophageal echocardiography, the average diameter of the atrial septal defect was 24 millimeter. The study at the edges showed insufficient edges in 22.2%. A balloon calibration was performed in only 6 patients, and the stretched diameter varied between 22 and 36 millimeter. The implantar tip protesis was the most used in 88.8% of cases, and we have 96% of success. The failure case was related to the blockage of the protesis in the iliac vein. No major complications were noted. We noted just only a transition to atrial fibrillation post-procedure in 3.7% of cases. And the mean follow-up was during 11 months. An improvement in symptoms at 12 months was observed in 70% of cases, and echocardiographic parameters of the right ventricle were noted in the short and medium term results. At transthoracic echocardiography, controlled at 3 and 6 months, right ventricle dilatation increased from 100 before the closure to 80 at 3 months percent and to 30.77% at 6 months. And systolic pulmonary arterial hypertension regressed at 6 months. There was a return to spontaneous rhythm in 7.4% of cases compared to the ECG before closure. So to conclude, percutaneous closure of the atrial septal defect can be performed safely and with good results in adult aged 40 years and over. Percutaneous closure of the atrial septal defects allows an improvement in symptoms and ultrasound parameters in the short and medium term. Thank you for your attention.